Good afternoon and welcome to Bariatric Friday. My name is Kemal Erkan. I'm the chairman of American Surgery Center. I'm here with Dr. Gail Wynn. Dr. Erkan is off this week, so she was available for us. And it also kind of makes sense for today's topic. But before I start with that, Dr. Wynn, how are you doing?
Doing great, thank you. How are you?
Good. You were already in the office today, or were you operating?
I was in the office today and then had to go to Glasgow to look for someone's x-ray.
All right. Well, thank you again for joining. So I was saying it kind of makes sense for you to be with us today because we are going to discuss the support group aspect of the bariatric process. And you actually run our support group meetings once a month. That's on Tuesdays, first Tuesday of each month at 5 p.m. And right. Now, I guess we can start with why do we need a support group for the bariatric patients, and before and after, how it's utilized, and what kind of questions they get, and how we can actually benefit from it. So we'll discuss those things together. But we can start from why they need a support group.
Sure. So one of the key things for before surgery, why do you need support group before surgery, is it gives patients an opportunity to talk to other people, whether they're before surgery or whether they're after surgery. And what I find is it's really beneficial because it helps the people that are anxious about surgery, have a lot of questions, concerns, worries. It helps ease them because they hear it directly from someone else that either had surgery or is also going through the same process. And the main thing about support group is to be there for someone else. And one of the things that I find is when you hear it from someone that has already had surgery, it really sets your mind at ease. When you hear it from someone that's also going through the process that might be just a little bit ahead than you, it also helps because it gives you ideas on, well, how do I maneuver the process? How do I make it through the diets before surgery? Little tips of what to do, say that you're struggling with your weight, things like that for before surgery. After surgery, it's really important because everyone is there to support you, to congratulate you when you're doing great and it really feels good, as well as to support you when you're feeling down, when you are struggling. One of the things that happens in support group is people give ideas about things that have worked for them. And it may help you as you are after surgery or struggling or before surgery also figure out what would work best for you.
So, I'm going to share something with you if I can find it quickly. So what you are saying in terms of how people are sharing certain things and what works for them and what doesn't. So this is from our Facebook support group. So one of the patients, so when they follow me, I'm going to put my glasses on because I cannot read anymore. So it's been a while, my bariatric family. So here are the specifics after 6 months. I went from 273 to 218 pounds. And then she's saying that there's some little bit pause there. And then because she was wondering, and then she decided to do the cardio fitness in the gym. And now I'm losing more, down to 205. Now, this is shared and it's not public, but it's because bariatric support group in Facebook is private group, but members can see their own. When I read this, it was just yesterday actually. What you see is, well, this person went through this great the period of losing 60 to 70 pounds, and then boom, it stopped there after 6 months, and then trying to figure out what works for them. And then she joined the cardio gym. Now she's able to lose more. And that, when I read that, it motivates me, right? So, but this is a real experience from someone who is going through this. So I guess for those types of things, I see it very helpful.
Right. It's very inspirational. You're absolutely right. It also, like you said, it kind of gives you an idea of, oh, well, maybe I'm struggling too, or my weight has plateaued. Let me see what other people are doing that worked for them.
So the other thing that I find it interesting, and again, having a group like this helpful, Dr. Wynn, you may remember. So this week we had two patients. Last minute, they canceled the surgery. They finished the entire process. So like we have almost 14 different checkpoints, and going through a 3-4 months process, doing all those visits, EGDs, cardio clearance, pulmonary clearance, the sleep, the home sleep study, in-lab sleep study, 3 nutrition classes, and yet after their surgical clearance, they couldn't actually do the final decision on the surgery day. So understanding that probably is really important, not just for us from the healthcare provider standpoint, but from the society and family members, friends. Like this is not an easy decision, and it requires everyone to kind of be more better support for the person who's going through this, because it's not an easy decision. So what do you think about those types of situations? What those patients who couldn't go through the process can do in those cases?
Well, I think one of the biggest reasons why people back out last minute is fear. So, when we see patients that come back after, say, they gained even more weight because they decided not to undergo surgery, first thing they say is, I was scared. And then the second thing they say is, I thought I would try again one more time on my own. And what they find is it's very difficult to do it on their own. And I think if they went to a support group, they would actually hear it from many other patients, because it's not just them that have this thought in their mind. I think almost everyone that has surgery has that thought in their mind of, oh my gosh, it's coming. I'm scared. And, I've even had one patient that was on the operating room table and have a panic attack and say, I can't do this. I can't do this. And as she was driving home, because we just canceled her surgery, she called me and said, I apologize. When can I get back on the schedule? And it is a scary thing, but I do think that having support at the support group helps. I think one other thing that we actually discussed at our support group on Tuesday is maybe having a buddy, assigning someone that just had surgery to someone that's about to have surgery, that could support them individually and say, hey, you got this, and help kind of relieve them of their fears. And I had a patient actually who, she almost didn't have surgery because the psychologist said she had a binge eating disorder. And so she went and saw a therapist and started really working on her binge problem, and resaw the psychologist, and they said, okay, I still have some apprehensions, but I'm going to pass her. Well, I just saw her. She's 3 months out from her surgery. She's lost 60 pounds in 3 months. That's 20 pounds a month. And she's doing great. And I said, and how are you doing mentally? And she said, this is the best I've ever felt. And she's so glad she had surgery, because not only did she lose a lot of weight, but mentally it helped her get into a good place. Being full when you eat also helps control your appetite, which helps her not go back to the ways that she was of feeling frustrated and feeling the need to binge. Emotionally, she's doing great. And I asked her, I said, would you be willing to buddy up with a patient? And she said, absolutely. And here was someone that almost didn't make it through the process. And now she's a very motivated person. And I think she's going to motivate others so that they can overcome their fears and anxiety about surgery.
Yeah, that's really important. So now the other thing is that there are so many examples that we have. Patients, almost 90% of the patients who are going through the surgery, they are losing almost 50% of their excess weight. So that's a a huge amount of weight. So then, well, someone who may be like 370 pounds, 6 months later, they're at 280, and that's a big change. It's not like me losing 10 pounds, right? So adjustment of that, like adjustment to that new life requires a lot of maybe new information, new knowledge, resource. So I also see the benefit of those who are actually successfully seeing the results of the weight loss. They can also benefit finding out what others are doing and how they are actually adjusting for the new life that they have. So what are the most common questions do you get on the Tuesday meetings?
So a lot of it is surviving the pre-op diet. That's one of them. The other questions I get are about, I'm struggling to get my protein in. How do I get that in? I am gaining weight back, say people that have had surgery like 3, 4, 5 years ago. What can I do to get control? So there's a lot. It's usually a mixed group. There's the pre-op patients, and then there's the people that are doing well, and then there's the people that are struggling, years out from their surgery and are trying to get back into a group that is supportive, that'll give them ideas on how to get back on track.
So the surviving the pre-op diet, I'm assuming you are referring to the robot.
Yes, absolutely.
So, in our case conference today, I was, I'm doing that partially in the last 2 weeks. I'm doing doing the intermittent fasting with 1 meal replacement with the robot. And then I was kind of like, because we do this every day, so I don't realize how it is for patients who are going through that 2 weeks. So then if it's the BMI over 45, so they need to get 5 portions or 5 pieces of the robot. And it's a tough process, that 2 weeks. What's the best advice for those people who have to live on those 5 things for 2 weeks?
Well, it's funny that you asked, because I actually did it 1 year. I did it for 2 weeks just to see what people were complaining about. And I have to admit, the first 3 days are really the hardest days. You want to eat your shoe by the end of the day, and you really want to eat anything that is in front of you. And I tell people, go to bed early so that you don't have the temptation. If you have the opportunity to sleep in, sleep in. And then, in between each of the bars, the soups, the shakes, you can do as much as you want of clear, unsweetened liquids like sugar-free Jello, sugar-free popsicles, diet drinks. And I say, get your favorite diet drink and just do that. Do as many popsicles as you want, because the sugar-free popsicles, they actually make you feel human. It's something to munch on. It feels good going down. And so after you get through those first 3 days, then, every single day you're going to be doing the same thing. So it's actually not so bad after you get through those first 3 days, but those first 3 days are the toughest. The other thing is there's soup, you could do broth, like chicken broth, beef broth, bone broth, spice it up with like different spices. And if you do that, that also tastes really delicious. And that's a nice break in between.
I see. And also like drinking, I guess, a lot of water, right?
Yeah, I drink a lot of water.
Like every meeting I keep this next to me so that I can show it to people.
Good fun.
So I do want to actually share my screen for this, just so that we can actually show people how they can join the support group. So pretty much on our CHRIAS website, this is the homepage. Right over here on the top right, there are two different things for support group. One of them is for our Tuesday meetings. That's the support group meeting registration. This is when you click on this, you have to register, and it's very simple. So you can just put your email and name, and it will tell you when that's happening, and you'll get a reminder. And then the other thing is our Facebook support group, which I find that very useful for our patients. So when you click on this last one here, that will take you to the Facebook, and then you can join there. While you are there, you have to be a patient of CHRIAS. So it's a private group, and there are a lot of good activities that I see. And then we do have to verify people who are joining, and there are 4 things that we really need to make sure that everyone follows, being kind, no hate speech or bullying, and no promotion or spam, and respect everyone's privacy. And the other thing is that this is a support group, so it's not like we want to kind of focus on the issues of a patient who are going through and then who may need help in different things. But if you have, what's the right way to say this? But if you have issues with not getting an appointment, that's not the place to have that discussion, because you can actually get an online registration, and then you can get a response same day. But this should be a discussion that's going to be helpful for others, or you definitely need help. So that's something that we need to be careful in the Facebook support group. And we did kick a couple people out, so because it was not helping. And we have to protect our patients who are benefiting from this, because it is a very useful tool for those who are going through the process and after the process, as we were discussing earlier. So anything else?
Kemal, that, if you're scared to be on a, public support group, we have it on Zoom. So you could not put your camera on, and we respect that. You could put a nickname as your name versus your real name, so that people don't know who you are, because we want you to feel comfortable. We want you to be able to share freely and not feel embarrassed, not feel like you're being judged. We want you just to be able to feel comfortable and get as much out of support group as you can.
Absolutely. It's the main thing is to be able to reach out to the individual, and that individual for that individual to feel comfortable with the platform that we have. As long as we verify them in the beginning, that is the case where they can actually hide their actual name on the discussion that we have. And this is, again, I know the process is, there are so many things that we have to do, but that's why we are here. That's why Dr. Wynn is here today, and that's why Dr. Erkan is on these calls every Friday. And we have webinars second and fourth Tuesday of every month at 6 p.m. And you can find it on our website again. So there are so many resources available, so there's no reason to be afraid of. And the other thing, Dr. Wynn, we always tell patients that this is the most effective way to fight morbid obesity. There isn't anything that's going to be more powerful to help those patients who are struggling with morbid obesity. So that's why we are trying to put a lot of public education out there for them to take benefit from that.
Absolutely.
Well, again, thank you for joining me today, and I'm sure you'll be back with other topics sometime in the future. And we'll be back next Friday, 3 p.m. same time. Have a great weekend. Bye-bye.
Yeah. Bye-bye.